Hi, let's talk about lesser known and lesser discussed topic of heart surgery, that is the heart valve repairs. Now as we all know that apart from bypass surgery, जिसको कि हम coronary artery bypass surgery कहते हैं, apart from it the major aspect of heart surgery is heart valve surgery. हार्ट के अंदर 4 valves होते हैं जो कि यूनिडायरेक्शनल फ्लो कराते हैं ब्लड को. उनके किसी भी वाल्व के जब खराब हो जाता है, डिस्ट्रॉय हो जाता है, तो या तो वो ऑब्स्ट्रक्शन करने लगता है या वो लीकेज करने लगता है, बैक फ्लो आने लगता है. In both the conditions, we need to either repair that valve or replace that valve. Now, today I am going to tell you the importance of repairing your own valve. Replacement of the valve is always a solution which we have. There are a lot of prosthetic valves, different kinds which are available, which according to the age and other conditions is what is best suited for you, we do provide. But the main aim as of now, present day, the world over, especially in the mitral valve, is to try to repair the valve. Why? Because once the valve is repaired nicely, it behaves as the patient's own valve and it lasts many years without the complications and the side effects of artificial valves. आर्टिफिशियल वाल्व्स अच्छे हैं, इसमें कोई बुराई नहीं है, बट उनके अपने कुछ कॉम्प्लिकेशंस और लिमिटेशंस हैं. अगर हम उनसे बचना चाहते हैं देन वी ट्राई टू गिव अ पेशेंट्स ओन वाल्व बाय ट्राइंग टू रिपेयर दैट वाल्व्स. अ वर्ड ऑफ कॉशन, हर वाल्व रिपेयरेबल नहीं होता, बट as a surgeon we try to repair most of the valve, and that should be the go to aim for every surgeon and a patient.